So we've had initially an outbreak. It wasn't a wave one because the people in Gibraltar, using their common good sense, managed to get a social lockdown in place before it became a problem. People talk about sombrero hats being flattened. We well and truly flattened it. It was more like Table Mountain. So I would say that actually we haven't even had a wave one. But I think, as I've used the analogy before, we're a dry bush caught between raging forest fires all around us. So even though we've been successful in pushing it back, driving it to extinction, we're one of the few places where we have driven it to extinction. The problem is our geography and our the way that we function as a free trade area, living off the goodwill of people to keep our services going. So we're not and never were going to be able to keep it out forever.
Well, is Europe experiencing a second wave? Because the first one never really stopped. Isn't this the inevitable effect of people returning to more or less normality in their daily lives?
It depends on what you define as a wave, actually. So, I mean, one definition would be we drove it to extinction and it's coming back. I think when I looked at this in February, it was pretty clear to me, because we had no immunity to it, that even if you managed to drive it out, if the rest of the world had the infection, you would inevitably get it back as soon as you opened your doors back to the rest of the world. Some places like New Zealand have the luxury of not allowing people in, but most of us don't. So it was inevitable that there would be a rise. I think what's people are experiencing at the moment is the fact that young people who have been driven to distraction and frustration are now wanting to get their social lives back, and that's precisely, I think, what's happening. And what I would want to say to the people of Gibraltar is we suffered collectively in that lockdown, and we did it for the sake of our elders, those that hold our memories, that tell us where we are and why we got here. And what we mustn't do is throw everything away. So whilst the sun is hot, it's summer, we want to socialise, we want to have our parties, the barbecues. Actually, the virus is still amongst us, and the safest thing we can do is do the things that we've been saying about social distancing, about washing your hands religiously, cleaning them, keeping a safe distance of 2 meters or more from other people. Yes, there is a sense, I've got children too, there is a sense that we want it over and done with. Most of us are really, really frustrated, but until we have a significant level of people, 70% or more, who've been vaccinated, we cannot assume this virus is not going to be amongst us.
I was going to ask whether you were concerned about people seeing the summer as something of a respite and behaving almost normally. If they think a second wave in the autumn, and you said not a second wave, but certainly a wave in the autumn is inevitable, isn't it likely that they'll stop taking responsibility for their actions and just think it's going to happen anyway?
I think there is a bit of that. I think certainly talking to people, there is this fatigue that is set in. I call it lockdown fatigue, if you wish, but there is certainly a fatigue. And I understand, I empathise. This virus, and as all viruses do, they hit us at our Achilles heels. And this virus has very successfully managed to attack the fact that we're social creatures. We need to talk and embrace, and touch releases hormones in our brains that makes us feel good. I've just come back from some of our compatriots celebrating Eid al-Adha, and they're shaking hands, hugging. The reason we do that is we show them our affection, we show them our respect. And at this time and day, I would suggest that the best way you can show that is by not hugging and not shaking hands. Show your respect and love and care for people by saying, I would love to do that, but I won't.
Well, measures have been introduced on mask wearing, and the Chief Minister has mentioned that there could be compulsory masks in the autumn, obviously working on your advice.
So people forget sometimes that I think late April we actually did recommend to people, I changed my advice and saying that you should be wearing masks wherever you could not be socially distant. And I think a bit of mask fatigue set in, if I'm honest. So I've seen people not wearing masks on buses where it's compulsory, or even in shops. And I would like to reinforce that message. Actually, the best way we can manage to stop this virus is by stopping spreading it. That's one of the prime reasons why mask wearing is important. You don't spread it to others. You do have a bit of defence, we now have found out, but not a huge amount. So certainly my advice to the Chief Minister is that we ought to be thinking about it, but I don't think the timing is quite right. I'm worried about mask fatigue. So I think when we're still getting sporadic cases, one or two occasionally every week, then I think it's a little bit early. I know the experience of people going to Spain and Portugal is somewhat different. I hope people come back and reflect on why they're doing those things. We aren't quite there yet, but we're watching this very carefully.
We almost think that the virus is going to return, you know, like the start of school. Summer's over, the September starts, and it's the start of the virus. Is it seasonal?
I think it's actually to do with social interactions. I don't think it's seasonal. We've tried to study whether there's a temperature effect, whether there's anything else, and the evidence is that it's social. At the end of the day, this reflects on our own social interactions. When we went into lockdown and stopped interacting, the virus died out. As soon as we start getting back to socially interacting, the virus is beginning to come back. The biggest challenge for us in Gibraltar is the fact that lots of people come here every day, up to 35,000 people a day for a population of only 35,000, and that makes it incredibly difficult. We can contain the virus through our contact tracing function, but we will not be able to stop the virus coming in. People might ask, why can't we shut our frontiers or anything else? But actually, a lot of our care, a lot of our essential services are provided by people who live on the other side. I accept that it's more expensive to live here, so I can see why people would come in. So we do not have the luxury. And in fact, as a trading nation, we need to have that interplay of people coming in. So in essence, we've got to manage the best we can, and I think we've done really well so far, but only because people have complied. It's the people of Gibraltar. At the end of the day, we've done everything we have to try to protect our elders. It's our elders we need to protect. So I say to young people, please, you're doing it for your grandparents, and even though you're frustrated, taking one summer out of your life means that if you can get another summer with your grandparents, surely that's worth it.
Well, the government would be reluctant to return to a lockdown. Do you think we've learnt enough about the virus to be able to contain it?
They certainly got better treatment now. We've got a better handle on what this virus can and can't do. I think the problem and the biggest challenge always has been is that we're not a large nation. Unlike Germany or England, we can't just lock down a whole city or area as is currently being experienced. So what I think we've got is our contact tracing function. We basically build bubbles around outbreaks of infection. I hope that we're not overwhelmed, but we've always had lockdown because we know it's worked. But I would share that reluctance with the Chief Minister because it's not pleasant, and it destroys lots of other things that are good in our the community, such as the economy. So we'd resist that if we could.
I was going to ask you that. How difficult have you found it marrying? You're public health, that's your role, and that's what you have to focus on. How difficult has it been for you to sell the public health when you've got conflicting interests like the economy and social concerns?
I think it's been enormously helpful to have the political class buy into it. And I don't mean just the government, I mean the opposition too. I think the issue is that if your political leaders understand and see, and there have been various interviews being carried out to demonstrate that they found it really difficult, but if they buy into that, and we actually had a whole of Gibraltar effect on this. Everyone pulled in together and tried to address it. That's why I think we've been successful where some other places may have struggled. It's been the fact that we have been small, we have been able to pull together, people were able to see the outcomes and see what was happening across our frontiers. So I think for that reason, it's not been as challenging as it might be. I'm not denying the fact that you have to go through a process to persuade the politicians, and I'm not denying the fact that politicians themselves have multiple competing interests pulling at them left, right and centre, and you've got to open this and you've got to open that. But fundamentally, the challenge that was put forward was we need to reduce the harm to our population, and in a close-knit community where everybody does genuinely still have affection and love and respect for each other, that's not been very difficult to sell.